My name's Jeremy Barlow. I'm Director of Standards at BCS, the Chartered Institute for IT. So I look after all of our professional standards, things like our chartered status and various professional accreditations for individuals. But I'm also the Chair of the Management Board of the Federation of Informatics Professionals. The community has played a really important part in helping us develop FedIP and get FedIP where it is now. FedIP is nothing without its community. This is not a centralist or a top-down approach. FedIP very much needs to represent the needs of its community, and that is the informatics profession. So we've got various networks across the country that we've pulled together with FedIP, be those stakeholders in terms of stakeholder organisations, various agencies of the NHS, for example, but also as professional bodies. There are 4 professional bodies that are part of FedIP. So SOCTIM, IRIM, BCS and FedIP all have a membership base and all have a proportion of those members in the health and care sector. So we've really sort of leveraged those communities that we already have at our disposal to help us evolve FedIP to where we've got it right now. So FedIP launched in May 2017 at UK Health Week. So we had a number of people at that launch signing the professional pledge, which was basically saying, I want to be part of the cause, I want to be involved, and I want to play a part in FedIP's development. Since that, we've been developing the professional standards which will ultimately underpin what FedIP is and underpin what the community represents. So we've been on a journey over the past few months of developing those standards. We've been running workshops around the UK, we've done online surveys, we've leveraged the members and stakeholders that we have at our disposal to get us to a point where we think we're in a reasonably good place with those standards, and we'll be launching those at the beginning of 2018, and asking people to start, signing themselves up, being assessed against those standards and appearing on a professional register. Those standards will be on an evolutionary path. We will have the stakeholder community manage the life cycle of those standards to make sure that they retain their fitness for purpose and follow the trends as technology in health and social care develop. So the NHS Digital Academy, which has recently launched, is a wonderful opportunity for FedIP to work in partnership with them. So the Digital Academy is very much about identifying the kind of CIOs of the future and CCIOs of the future. So there's a clinical side and a non-clinical side to it. And really those people that go through that programme can become the poster children for professionalism in informatics. So the opportunity for FedIP to collaborate with the Digital Academy, for example, on things like accrediting their programme, helping them develop their curriculum. They are at a very similar stage to we are in terms of their relative maturity and where they are in their development life cycle. So that's a great opportunity for us to learn from each other, because we're chasing the same goal, which is ultimately a well-qualified level of professionalism within the CIO and CCIO community. FedIP, I see as well, is also the legacy of programmes like Digital Academy. So once someone completes the Digital Academy programme and it effectively graduates from that programme, what's next and where do they go from there? In many respects, that's where the role that FedIP plays, is that we take them on from that point. We accredit them. Those people are then on a professionalism continuum, so they have to maintain their CPD, maintain their professionalism and so on, and that's what FedIP professional registration is. It can be a vehicle for. Our role with them going forward will be very much to work alongside them to ensure that the curriculum that they develop and the professionals that they produce are in parallel to our professionalism agenda, and that we can professionally recognise them as such. And we're working with the Digital Academy people right now to ensure that their curriculum aligns with the professional registrations that we're developing as part of FedIP, so that we should be able to professionally register those participants in that programme once they complete that programme. I think the future for FedIP is a bright one. As I say, we're at the start of the journey in terms of FedIP as a relatively young organisation, but it is coming off the back of a lot of good practice, and it is an evolution of how informatics in health and social care has developed over the years. Technology is becoming more and more prevalent, obviously, in health and social care, and has a real opportunity to revolutionise health and social care. But that requires skilled people, capable people, accountable people. It also requires a profession that's seen as such as well, as seen as a profession. I think, the way that technology is now embedded in health and social care, and the way it will continue to be, continuously be embedded in health and social care, that there's a real opportunity for the informatician to be standing shoulder to shoulder with their clinical colleagues, whether that's the surgeon, the doctor, or whoever. I think there's a real opportunity for technology to enhance the care that's given by the clinical colleagues, and that requires a level of professionalism from the informatics professionals. I think it's also really important that it underpins trust and confidence within the users of health and social care. So society has a certain expectation when a member of the public goes to a doctor or goes for an operation or whatever it is they do. They expect a certain level of professionalism, a certain level of care, and they expect the people providing that to be well qualified. As technology is becoming more and more intertwined in that health and care, it follows that they should expect that from those that are producing those technologies as well.